Endlessly scrolling, messaging, and watching videos? You may know your screen time limits, but how about your kids or your grandkids? And how does this affect their health? With me, I'm joined by Pediatrician Julianne Schwerdtfager to share with us. Well, doctor, thanks for coming on the show. Let's start out with how much media time is too much media time for children?
So that's a very good question that we get a lot in the office. So media time is a hard thing to limit as a parent, but the AAP is saying that the most appropriate media time for most children is between 1 to 2 hours a day. And that's for older children. When you talk about young children like babies, we want to make sure that they're not really in front of screens at all.
What are some of the effects for a child who maybe has a little more screen time than usual?
There are a lot of negative effects that we are starting to see from increased screen time in children. So one of the biggest things that we've seen associated with increased screen time is obesity in kids. We also see some dry eyes and some vision issues for kids who are staring at screens all day. And then we see a lot of sleep problems from screen time, especially screen time before bed.
Are some apps better than others? What are your recommendations?
For infants, we try to not use apps at all, just because they shouldn't be on screens yet. But certainly there probably are some apps that are better than others. We want to focus on using educational TV, educational apps, but more importantly than using just educational apps on TV is spending that time with your child while they're on them. This is something that we call co-viewing. So we want to make sure that parents are co-viewing and co-playing with their children, because we've seen even if the app is educational, children learn better from it if their parent is interacting with them during use.
What are the recommendations for appropriate age for smartphone use?
This is probably going to differ from family to family a little bit based upon what your child's doing and what you want the smartphone to do for your child. Children are going to mimic us, so young children are going to want smartphones because we're on our smartphones, but that doesn't necessarily mean a young child needs one. So most parents, when thinking about a smartphone decision, are going to think, is my child ever spending time without me? Is it going to be useful for my child to be able to reach me, or for me to have a locator on that phone just in case I need to find my child? We also want to make sure that we are being safe with those smartphones. So there's a lot of trouble that kids can get into on smartphones, as most of us can imagine. So making sure that there are parental controls in place on your internet, on your smartphones, on your TV, this is all really important because it is so easy for a child to get into material that we don't want them into. The other thing that I would make sure you have on a smartphone for your child is a screen time lock. So making sure that they're not spending all day staring at that phone, and making sure that it will lock and not let them stare at it after a certain amount of time. And there are some apps for that as well out there.
Like you said, there are some resources that parents can get. Number one is Salina Pediatric Care, and talking to your pediatrician. What are some of the other resources?
Healthychildren.org, we've put out as a resource before. There's actually a family media use plan online there that's really cool. So you can go in with your specific family needs, your specific children's ages and kind of their developmental stages, and go through and look at what's appropriate for my kid at their age and for our family needs. And then one of the other great resources is commonsensemedia.org.
Thank you for watching The Pulse. For more information, please visit srhc.com. Like us on Facebook and follow us on Twitter.